basically we should be commenting on, we can comment on ocular discharge, unilateral, bilateral, nasal discharge, unilateral, bilateral. You get an idea of face shape, face symmetry, ear carriage, whole face symmetry, whole body symmetry, how it is responding to the environment, how it is responding to us. Is that what we expect it to do, or is that different to how we would expect it to behave? That's also less so in sheep, more so in cattle, whether it is going to be safe for us to approach that animal, and whether it's safe for that animal for us to approach, or whether it's going to try and do run into the wall, jump out of the pen. You're assessing how basically you're going to get beside it and restrain it in a safe way so you can examine it.
We also want to take the respiratory rate, which should give us an idea of whether there's any pulmonary edema. Again, we're looking at the character as well. We're looking for dyspnea, hyperpnea, and tachypnea. When we approach the animal, what we want to do is assess whether it's dehydrated or not. And we can do this visually from a distance by looking at the eyes, but we also probably want to check that up with a skin tint.
Mucous membranes, because quite often they're pink, whereas the mouth may be pigmented. Any sign of discharge. To have a look at the eyes, we are looking at the 3 conjunctiva in each eye. So we're looking the ventral, dorsal, and third eyelid. That's the ventral, so you're pulling the eyelid down, you're pressing it in above the orbit. Dorsal, you're lifting the upper eyelid, and the third eyelid, again, you're holding ventrally, stretching the eyelid ventrally, lifting dorsally, and popping onto the eyeball and out tops the third eyelid. So you're looking for colour, you're looking for discharge, and you're looking for whether the mucous membranes are injected or not. Lower, upper, and third eyelid. Capillary refill time, do that in the gums, pigmented but still possible. And this is normal. We're returning within about half a second of launching. Next, in sheep without much wool, or before they've got a full fleece, you can see the jugular groove quite nicely. You can try raising that. So you're starting to see the rise if you just focus on that area. It is very subtle. Okay, we'll move back to the thorax then, and the first thing I do in the thorax is to auscultate the heart. I usually start in the left hand side. How I do that, locate where I want to auscultate the heart is I feel for the next beat, which is usually at the point of the shoulder, and then I will move forward. One can hear whenever the 3 valves are at the maximum intensity, and I tend to use the noise that the valves make, so the sounds the valves make, to optimize how I'm listening. I don't tend to go for fixed points. So basically I locate my mitral valve, then I'm moving forward to my aortic. And then on to my pulmonic, which usually is an awful lot further than most people anticipate. An awful lot more for the cranial. And what I'm listening for is both the rhythm, so whether it is a regular rhythm, whether it's an irregular rhythm, and also whether it is overly loud or muffled, whether there's any extra heart sounds, so whether we're getting split heart sounds, whether we're getting extra murmurs. So I'm listening to all those things on all valve locations. And then we're going to have to go round to the other side of the sheep to listen to the tricuspid, which normally is more faint. And listening for the tricuspid on the right hand side of the chest, again I go for the point of the shoulder and then move the stethoscope around to try and optimise what I'm hearing. When we're feeling for the femoral pulse, or the place where we feel for a pulse in the sheep is the femoral pulse. You're sliding your hand in. So what I'm feeling for in the pulse is I'm trying to take a pulse rate, and ideally I will do that at the same time as listening to the heart so that I can detect whether there's any drop beats or not. I am listening to, or feeling for the rhythm, I'm feeling for the rate, and I'm also feeling for the quality. So whether that is a strong pulse, whether that is a pulse that rises quickly and then drops away, which I would expect in anemia or a hypovolemia or a shock type situation.